Welcome to the Health Daily Show, your go-to where leaders, founders, investors share insights on growth, innovation, business building. I'm Chitra Nabat. Joining us today is Dr. Liz Kuo, Chief Medical Officer, Everly Health. Liz, welcome. Thank you for joining us.
Thank you for having me.
Liz, Everly Health, what is it? How does it work?
Sure. It's a home diagnostic company. It was founded on the idea of empowering patients and providers to do home testing and make better decisions with modern diagnostic care.
Bring this to life with us.
Sure.
With some examples, use cases at scale.
Sure. We have had some tremendous success, everything from people that are focused on food allergies and sensitivities to being able to know what foods they should eliminate to home testing. We recently had a patient that basically had very severe diabetes. They didn't know it. We called them, we located them, we actually then assisted them to get into a hospital. We basically had saved their life. They didn't know how severe it was, and we did a kidney test and other things to follow up. We've had all sorts of stories about people having some symptoms, not knowing what to do with them, and then being able to test and then ultimately get treated for it through our platform.
What's the level of penetration in the market?
Sure, it's quite heavy. I mean, since 2020 have done 50 million tests, and this is from our provider network. We have all 50 state licensed doctors, but we also have something called diagnostic solutions where we work with partners to enable that. Our tests in general are also, we have a consumer market. So we have a great way for direct-to-consumer people to purchase our test kits, in addition to being able to do things like fertility treatments and others.
What's unique and different about your business model and operating model?
Okay, that's a great question. So what's unique is we're diagnostic driven. Some of these other companies have joined in the race for diagnostic care. It's always been our focus. We have every kind of test you can imagine from the comforts of your own home. We especially know during COVID, people have put off care. For example, they put off colonoscopies or any kind of screens. And right now what we do is we allow people to do testing at home. So sexually transmitted illnesses, diabetes, cholesterol, heart health, we have it all. And in addition, we do test to treat. So we can actually treat the patient, write a prescription, and send it to them. On top of that, we have this great platform. We have an iOS app. We have ways to track their own care for a patient. And ultimately, it's sort of end-to-end seamless.
How do you then think about the patient journey and patient retention? Because a lot of what you just described, especially in diagnostics, it's episodic. It's at a particular moment in a particular year when a patient has an issue. So how do you think about that versus a continuous long cycle relationship with the patient?
I think a few ways. One is that we work with a lot of health plans. We have 8 out of the 10 health plans, and we work with them to close care gaps. So these are our quality metrics. And what we do is we get their eligibility files, we figure out how to support them, and then we follow them in their care journey. We make sure we track them. We follow up. If they have a positive FIT test, which is a colon cancer screen, we make sure that they get a colonoscopy afterwards. In addition, we do things such as you come in, let's say for right now, something called virtual care consults. We're able to track them, put them in a membership plan. So allowing them to say, have a regimented next step, checking with them, scheduled consults, and we make sure that they check in with us regularly. So we track them over time. And in addition, now we have biometrics. So we're able to keep track of if their A1Cs are going down, if their weight is getting more controlled, and things like that.
What's the plan to get to market adoption at scale?
Plan to get to market adoption is right now we're working on virtual care consults, right? But it's a flywheel. So this is where consumers can find us based on symptoms. The next step, though, is we also work with our B2B partners. These are our partners that are payers and health plans who want to get coverage. And so they're working with us because we're a provider network to allow them to both have a flywheel. So consumers find us and then they can be converted to our B2B plans. And B2B partners, when they allow us to work with them, then they become our consumers.
You talked about expanding into telehealth. Share the scope of the services,
Sure.
pricing, implementation.
Absolutely. So at $59, it's a virtual care consult. These are people that have certain symptoms. They may not be ready to purchase a test, but they want to work with our physician network and they want to learn about it. So it's about 20 to 30 minutes. It's also for patients that are 18 and above, 50 state licensed board certified doctors. And they come in scheduled with a consult, and then they follow up with a lab test if they need to. On top of that, once they have a lab test, we can also do things like scheduling an antibiotic for them because a positive result comes back. So what's baked into the test itself is the consult cost in addition to all the follow-up that's in.
Telehealth, though, is quite saturated.
Yes.
Many telehealth point solutions. There's many at the Vive conference.
Yes.
And telehealth, the market shift and trend is that it's going from point solutions to multi-product virtual solutions. What's your strategy and where is there a competitive advantage?
Absolutely. So virtual care concepts is where we're starting. We're setting up of infrastructure for everything. So anyone that has any symptoms can come in. But we also have multiple areas where we're focused on. So whether it's fertility, to home testing, to tracking their symptoms. But our strategy is diagnostic-driven care. So 70% of medical diagnoses come from lab testing. And if you consider that ramification, you also think about the ways that people in telehealth, like you said, it's table stakes now. So how do you actually improve the ability for a physician to have an informative consult with them is through lab testing. And this is where we have wraparound lab testing services to support the physician in getting their diagnosis and then treatment plan and then follow-up care.
Bring to life this flywheel for us.
Sure. So an example could be if a patient comes in, they are trying to manage their weight and they have a few other things. They have some cholesterol that's higher. They also have some high blood pressure, and all these tests that we can have for them, we track over time. Then we actually work with the payer then to say, hey, this person is trying to lose weight, but their A1Cs are actually going down with our system. Can we actually have coverage that's even better? And so we're allowing for the prior auth to basically go from a consumer now to a B2B play, and back and forth. Also for consumers, now that they know about us, then they can also come back to us through the payer.
This payer channel.
Yes.
It's very difficult for many startups to get traction, engagement with payers. How did you guys do it? And what does the next level or the next phase of your payer relationships look like?
Oh, great question. We work very closely with payers to close care gaps. So NCQA is the National Committee on Quality Assurance. And they basically set certain metrics to say, if you do this XYZ, payers can have a reimbursement that's higher because they're doing screenings. So we work with payers to close their care gaps, their screenings. And it includes right now A1Cs, which is diabetes, and also colon cancer screen. This is just the first inroad when we work with them. The next step is working with payers on annual wellness when patients don't have a PCP. And figuring out how to go into that payer space is what we're working on right now. We have these great relationships with them, but ultimately we also see if we can work with NCQA and these other government organizations, we would like to be able to cover kidney tests for diabetics. It's often undiagnosed, and it leads to poor outcomes with end-stage renal disease and dialysis. So if we can catch them early, we can save a lot of the healthcare costs. It also improves the quality metrics, reimbursement from CMS for payers, and we believe very heavily in working with policy and government regulators to all work together to push this forward.
Liz, leadership.
Sure.
You studied a lot about leadership with your 1 degree out of Stanford and 3 degrees out of Harvard. In life, business, career, there are rules, norms, codes on how things are done.
Yes.
Where have you been a code breaker and how did you do it?
Oh, so many ways. First thing is people always told me, you have to say out loud what you want from the universe and to let people be stewards of your own journey. And I really believe that. So I've always thought through, what do I want from my career, from my degrees, from my life to extract the moral out of life? I will also say that I definitely had my own issues with my own fertility and journeys. I had a stillbirth in my first pregnancy and I lost the baby at 9 months. I actually internalized that and said, how can I turn this into a strength? So when I meet people in business partnerships, I'm not afraid to be vulnerable. I'm not afraid to say out loud that this happened, but I'm not a victim. I am empowered by it. I was a patient, but I'm also a provider, and I know that there are ways to solve for it, whether it's home testing, remote patient monitoring, ways to really improve the way that we think about technology and care, and pushing the envelope on regulation and helping to, of course, ensure quality and having certain standards for it, but being able to say, hey, this isn't done right. Our healthcare system is failing 83 million people that have provider shortages. So let's figure out how to make this better. And I focus a lot on that whenever I think about partnerships, doing business. I think a few things too is joining boards has been really helpful for me to see from up top how things and decisions get made. So I've really enjoyed that. And I think I encourage a lot of people to start sitting on boards and working through that.
Liz, thank you so much for joining us.
Thank you. Really appreciate you having me.